Good evening, everybody. My name is Taylor Carroll. I'm a board-certified nurse practitioner, and I practice in gastroenterology, or GI, at KSB. This evening, we're going to be discussing digestive health, so thank you for tuning in. This is a common question that we encounter daily in our practice. What is digestive health? It's how well our body works to digest our daily intake. So this includes food, drink, medications. Our GI tract works as a barrier between our intake and the rest of our body processes, and a good balance of our microbiome. And what is the microbiome? It's a common word heard lately, so you've probably encountered that. It's a collection of microbes, which includes fungus, bacteria, and viruses that live naturally in our GI tract and work to absorb, digest, and break down our intake throughout the day. This provides, like I said, as a barrier between our intake and the rest of our body so it can perform the processes it needs. Why does this matter? Because this can contribute to how well our body works based on what we're eating and drinking daily. What affects our digestive health? Our daily habits, including our diet, like we previously said, our sleep habits, our social habits, including smoking, alcohol, vaping, and marijuana use. Illnesses, this can include acute illnesses like the common cold, viruses, or chronic illnesses such as diabetes. Medications we take, and this includes medications for those acute illnesses such as antibiotics, or medications that we take for chronic illnesses such as our diabetes, and mental health. Acute experiences that can lead to stress, say a change in relationship, a change in career, moving, a loss in the family. Any big event in our life can affect our stress, which can affect our mental health and ultimately our digestive health. And chronic illnesses such as anxiety, depression, those can have an effect on our digestive health as well. Signs and symptoms of affected digestive health. So these are common feelings that you may have on a routine basis if your digestive health is affected. This includes bloating, flatulence or passing gas, altered bowel habits, including diarrhea, constipation, or a mixed pattern of both of those. Also, our stool consistency, abdominal pain, indigestion or acid reflux, heartburn, and belching. How to manage our digestive health? First and foremost, and on everybody's mind, is our diet. It's best to follow a whole foods-based diet, and this includes a diet high in fiber. Fiber products would include fruits, vegetables, whole grains, and examples of whole grains are whole wheat bread, brown rice, and oatmeal. Seasonal eating, so to eat the fruits, vegetables that are in season. So in the fall, squash; in the spring, rhubarb; in the summer, our berries. And this provides a great variety for our diet, which helps our microbiome to continue with the good bacteria and fungus and viruses that it needs. Water is the best beverage to have on a daily basis. If you need variety with your water, using fresh or frozen fruits like blueberries, strawberries, lemon, and vegetables like cucumber in your water to provide a taste is beneficial. It's best if you can avoid any added sugar, artificial sweeteners, so anything that says 0 calorie, no sugar, sugar-free, and diet pops, any zero pops, and then shelf-stable meals and snacks. So any kind of boxed foods is kind of a generalization to avoid. Exercise, daily exercise, or multiple times a week, say 3 to 4 times a week. Any kind of exercise that you can fit in throughout the day would be best. With the warmer weather coming, it's always nice to take a walk, maybe in the evening after you have your last meal. Sleeping, make sure that you're getting adequate sleep for the next day to prepare. This helps with our immune system, which ultimately affects our digestive health. And stress management. So as we discussed earlier, any acute situations that are contributing to your stress, finding mindfulness activities such as journaling, doing one of your hobbies like photography, doing puzzles, reading, Anything that you can kind of take a break from your mind for a couple minutes is best. Also, if you have chronic anxiety and depression, like we discussed earlier, attending therapy is helpful, or taking certain medications to manage those illnesses can ultimately contribute to better digestive health. A very common question we encounter is probiotics. So what's the difference of probiotics versus prebiotics? Probiotics are the good bugs for our system that it needs. So when you take a probiotic, you are already taking that good bug, for lack of a better term, of what our digestive system needs. A prebiotic is any kind of supplement or food that will help our body to grow those good bugs that they need. So a prebiotic can be considered food for our good bugs in our digestive system. This comes down to host health and how well it can use those prebiotics. So having a good digestive health ultimately benefits our body when we eat and take these prebiotics to contribute to more good bugs to be produced, which also creates good digestive health. So it's kind of a cycle for us. And last but not least, a common question that we get around colon cancer is, can I prevent colon cancer? And I bring this up because the rates of colon cancer are rising, and especially in the younger population. One of the risk factors that they have identified for colon cancer includes obesity. So many of the tactics that we just discussed in this conversation can ultimately combat obesity if performed and implemented on a daily basis. Helpful habits that we've identified to help avoid colon cancer or improve your chances against colon cancer include a healthier diet. A potentially protective factor that they've identified with our diet is a diet high in fiber. So as we previously discussed, fruits, vegetables, and whole grains. Try to avoid as much as possible red meat, processed foods, like we discussed earlier, any boxed meals, boxed snacks, tobacco use, and alcohol use. As always, we want to know with our health in general, and especially our GI health, what are red flags that we need to watch out for. Any new symptoms that you feel are affecting your daily life or making your daily life hard to live. This can include needing to find a bathroom quickly, uncomfortable symptoms after you eat, and in general, red flags in our GI system include unintentional weight loss for any reason, any sign of GI bleeding, and any new chest or abdominal pain that is related to or after eating. That concludes our presentation on digestive health. I'd like to thank everybody for tuning in, and hopefully you learned a few more tips. Again, my name is Taylor Carroll. I'm a board-certified nurse practitioner, and I practice in the gastroenterology department at KSB. If you feel any of this presentation is helpful to you and you need further evaluation, please reach out to your primary care provider to determine if you would benefit from evaluation with our department. Thank you.